Hello, everyone. Thank you for attending. This is the Dickinson County Healthcare System, DCH, COVID-19 Q&A, question and answers. Hosted today by DCHS staff members, Dr. Toby Carlson, Chairman of Infectious Control and Disease Committee, and myself, Joe Rizzo, Director of Public Relations. Today, I will be asking Dr. Carlson the questions, and Dr. Carlson will be answering them for you. We hope this message finds everyone doing well. First slide is our disclaimer. The disclaimer says Dr. Carlson is not acting as anyone's regular physician, but rather these are his answers to general questions. If anyone is experiencing symptoms consistent with COVID-19, they should contact their doctor. We offer some assistance here with COVID-19. We have the Dickinson COVID-19 hotline, area code 906-776-5858. It's fully operational. Please call the hotline if you're feeling sick and experiencing serious respiratory problems. We also have our Dickinson COVID-19 Respiratory Clinic, 906-776-5913. The clinic was developed so that providers whom feel that their patients may be of high risk and may be exhibiting symptoms of COVID-19, they can refer to the respiratory clinic for further COVID-19 screening and eventually possibly testing. Additional COVID-19 resources, we have right here michigan.gov/coronavirus. That is an excellent statewide resource, and then below that you'll see the CDC link, the Center for Disease Control and Prevention link, which is also an excellent resource. A lot of information there, very valuable resources. It would be foolish for DCH to try and duplicate all this, so we do refer folks to these resources for their own benefit. And you will hear throughout the Q&A, Dr. Carlson will reference these resources as points of interest. That takes us into our COVID-19 update, and I will ask Dr. Toby Carlson to please deliver that update to the group.
Hello, everybody, and thank you, Joe. Obviously, we're talking on April 7th of 2020 at this point. And one of the points I'd want to make at the start is the questions that I'll be answering, I'm going to be answering to the best of my knowledge at this time. Things are very dynamic and changing all the time when we're talking about COVID-19, so please keep that in mind if you're hearing this several days or several weeks after the initial recording. Currently, we at our as far as our screening and evaluation, we are aware that there are 2 cases in Dickinson County, 2 cases in Florence County, and 3 cases active in Marinette County. As Joe mentioned, I'm the chairman of the Infection Control Committee, and we've been working very hard on trying to get the hospital lined up to be able to, number one, marshal the available services so that we can deal with patients, and also to support the medical staff as we see fit. We've been meeting for several weeks now with multiple meetings. The one that starts things out is 7 in the morning. We go through the whole weekend, including Saturday, Sunday, Palm Sunday, etc., where we have a meeting where it's called our steering committee. We have a large group of hospital personnel who we talk every day about what available supplies we have for personal protective equipment, for our healthcare workers, and what is the latest as far as what's going on in the hospital, any hotspots that we might see in as far as where we're at with N95s, respirators, ventilators, and other supplies. And as I've mentioned before, our hospital system has been preparing for similar emergencies for many years, and I feel very proud to be a small part of the organization that has risen to the occasion, represents many people. Having said that, Joe, why don't you go ahead and start with the questions, and let's see what we can come up with as far as answers.
All right, Dr. Carlson, thank you very much, and thank you for agreeing to answer these questions today. Let's begin. So the first group of questions are related to the spread, safety, and risk levels. These questions were comprised from members in our community, and we are going to address all of them and hopefully provide all the answers that folks are looking for. So first question is, as a systemic lupus patient, I am hand washing frequently, sanitizing, and I avoid going out in public as much as I possibly can. Are there any special precautions I should be taking during this time to protect myself?
That's a very good question, Joe, on a couple of different levels. Obviously, I think we've all heard over and over again, but at the national, state, and local level, that it's very important to prevent the spread. And our major arsenal part includes frequent hand washing, where there's contact with surfaces or objects that could be infectious. Social distancing and avoiding getting in contact with people who potentially have the problem, and trying to not go into situations where you might pick up the virus. Another interesting point of a patient with systemic lupus, the medication that is being very carefully looked at as one of the potential treatments for COVID-19 is a medication called Plaquenil or hydroxychloroquine. And a number of patients who have lupus are also on that medication for its ability to treat lupus, rheumatoid arthritis, and other collagen vascular inflammatory disorders. The interesting wrinkle on that is that when this first came out as a potential treatment, our supplies of the Plaquenil in the area were very low. I think we had enough supply at the hospital for 2 ventilator patients. Fortunately, as part of the work that's been done at the hospital, we have a much more robust supply of that right now. And also for patients in our area who have things like lupus, if they are on that medication for treatment, there should be an adequate supply. So it kind of hits on both of those areas.
Great, thank you. Moving on to the next question. How likely is it that someone would catch the virus if they were simply in close proximity to an infected person versus direct contact?
Yeah, we really have seen that this virus is we know how you catch this virus, and it's by what's called droplet spread. So what you really need to avoid is droplets from people who have sneezed or coughed or touched something. So just standing next to somebody, if you're not in that 6-foot range, it would be very unlikely that you would be picking up the virus unless you touched something that had the viral particles actively on it. So the frequent hand washing and social distancing is really one of the keys to avoiding catching this disorder. And in addition, we're starting to hear from our federal, state, and local agencies that we're starting to encourage use of masks to try to stop the spread, to keep those droplets from being inhaled or from touching the mucous membranes where the virus can get in.
Great. So, reading ahead to the next few questions, I think you've kind of touched on them in the last one, but let's go through them anyway. What advice do you have for those people who are deemed essential workers who are out and about each day?
Well, again, the answer there is very important to follow the advice of the CDC, the federal government, and the state government. I think we're starting to see some good news on the horizon. We're not there yet. The fire is not out, but it doesn't seem to be getting bigger and bigger. And I think it's very important to recognize that if something is considered to be an essential function or an essential job, it's going to be important for us to, if we're able to safely to stay at work and to look at those mechanisms to get us back to work when it's safe to do so. But again, the things with social distancing, frequent hand washing, and possibly wearing a mask are still important.
Great. How long does the virus remain on surfaces such as steel, plastic, paper, etc.?
The COVID-19 virus can stay on surfaces for several hours to days. There's been some debate exactly how long those can last on surfaces, but it is a relatively short period of time. But they can stay on surfaces for some hours.
Great. And what is the most common way to become infected?
Probably close contact from a sneeze or a cough or touching some object that has the viral particles on it. The virus gets in by, for instance, if you touch some material that is infected and then touch your face, particularly in the mouth or the nose area, the virus gets in that fashion.
Okay. While the core 3 symptoms, fever, dry cough, shortness of breath, are commonly spoken of, we hear of infected people showing additional symptoms such as loss of taste, smell, etc. What should people know about symptoms?
I think the 3 points that were brought up first are really the important ones. The condition called anosmia, A-N-O-S-M-I-A, which is the loss of smell, the sense of smell, is one of the unique features that seems to pop up in some patients, but it seems that it's not hard to recognize that somebody is feeling pretty sick if they have the COVID virus and might need testing or medical attention with those first things, the fever, the dry cough, and the shortness of breath.
Okay, thank you. Still questions about spread, safety, and risk levels. My coworker's wife is a nurse. How has I think there's a typo there, sorry. My coworker's wife is a nurse, has been in contact with confirmed cases. She was wearing the proper PPE at the time. Is it safe for us to work with him now?
Well, the answer to that is, and we have people in the hospital right now who are in contact with patients who have COVID-19. The proper protective equipment for those people includes the N95 masks that we're hearing of, or even a higher level of masking, goggles or some form of eye protection, a gown to prevent contact with surfaces that contain the COVID-19, and gloves. The healthcare workers at our facility are very fastidious of doing that, and it's been shown to be quite effective in a number of studies to protect healthcare workers from getting the virus. So the second or third hand contact should not be an issue.
Okay, and just to clarify there, Dr. Carlson, you did say that we have workers in our hospital that are in contact with those with COVID-19. Am I correct in saying that they were in contact because we do not have any cases in the hospital at this time?
Yeah, I'm sorry, I should mention. And there's kind of a patients who are also in limbo. That is, patients who are hospitalized with suspicion for the COVID-19 virus who are currently being tested, but the test results have not come back. But yes, I stand corrected there, Joe.
Okay, I just didn't want to alarm folks. We do not have any positive COVID-19 cases in patient at this moment that we're aware of.
That's correct.
Okay, great. So is it safe for us to work with other people who have household members who have been in contact with confirmed cases?
The key, according to the CDC and other agencies, including the Michigan Department of Public Health, is whether a person is symptomatic. And symptomatic means the things that we talked about: fevers, chills, cough, scratchy throat, dry cough, that type of thing. So if the household member does not have those symptoms, you should practice the social distancing, hand washing, etc., that you would do with other people, but it should be safe.
Great. My wife is 7 months pregnant. What are the COVID-19 risks for my wife and our unborn child?
It's a very good question, and I get asked that very frequently. The COVID-19 virus seems to be a virus that the dangerous population group, where the worry is, as many of us know, is in the older population with multiple other health problems, such as COPD or emphysema, diabetes, other immune-related problems. And usually it's in the patient population who are over the age of 65. Now, pregnant women do have a variety of changes in their body, of course, and it does change their immune status. In some senses, their immune status is heightened. In some senses, there's some concern that they may have differences in their ability to fight off certain infections. To the knowledge of the CDC, there does not appear to be clear-cut evidence that pregnant women have an excess risk of either catching the virus or passing it on to the fetus. Fortunately, I think many of us recall back in the last Olympic year, there was a concern about a virus called the Zika virus, which the high-risk population there was very clearly pregnant women. But this virus does not appear to have that particular feature, thank goodness.
Very good. I have allergies with a runny nose and light cough, some drainage, and my coworkers are looking at me like I'm a criminal. What can I tell them so they understand I'm not carrying this virus any more than they are?
Well, as far as communication with coworkers, I just hope that people realize that the keys that we watch out for are the fever and the dry cough. And obviously, it's very impolite to cough on somebody, and certainly this coworker needs to cover their mouth with their sleeve if they're coughing. Well, this might be a good person to strongly consider wearing the cloth mask that the CDC is starting to promote for people in everyday life who are out and about. Other than that, it might be worthwhile just to explain the situation to other coworkers and keep a close eye on whether you have a temperature. Perhaps, as we tell some of our healthcare workers who've had some contact with COVID-19, check your temperature 2 or 3 times a day, and if it's at all elevated above that 100.4 degrees Fahrenheit, they should contact their primary care doctor or the COVID-19 clinic or our hotline.
Very good. The next question, I believe you answered already. Multiple reports from people infected that the loss of sense of smell occurs prior to any other symptoms showing up. Is this valid? I would say that was asked and answered.
Yeah.
Should we all wear cloth masks, not N95 masks? I think you've touched on that as well.
Yeah, let me make a couple of comments about masks. The N95 mask is designed to protect people from breathing in the virus. And as everybody knows, it's been in somewhat short supply. The supplies are getting more robust minute by minute, and so fortunately we are seeing that we currently have adequate supplies for people here at the hospital. The surgical mask is used to prevent. It's used to so that N95 is used to protect the wearer and people around the wearer. The surgical mask seems to have some good effectiveness in preventing the wearer from coughing or sneezing or otherwise causing droplets to go into the environment, and so therefore it's mostly protective of other people in the environment. Now, the cloth mask that we're starting to recommend people wear has some limited ability to also decrease the droplets, but is probably lower on the effective totem pole as far as being effective for that. But I think that pretty soon we're going to see that as part of this intermediate time when we're trying to, in some ways, get back to normalcy, one of the ways to become a little bit more able to be out and about would be to wear the cloth mask when in public.
Okay, very good. If you are outside walking, biking, running, or whatever, is the virus airborne? Can you still catch it if you are at a safe distance?
As I mentioned, the virus is a droplet, so that if the droplet has settled to the ground, it is unlikely that you're going to come in contact with those types of activities, so it should be safe. Okay.
What type of hand soap is most effective? Does it have to be antibacterial?
Any hand soap is effective as long as you wash your hands for the 20 seconds or more. It's difficult to do. But we should all get into that habit. But it's the time that's the most important part, not whether it's listed as a, quote, antibacterial or antiseptic soap.
Can pets contract and or carry the virus?
There's been some interesting reports that I think many of us have seen reports on. I think they're tigers in one of the Bronx zoos who purportedly have caught the virus from a zookeeper who had COVID-19 in the hotspot of the New York City area. According to the CDC, there has not been any reports of catching the COVID-19 from a family pet or a pet to a human being. However, if there are questions, the CDC.gov does have some guidance that I would recommend people look into as far as how to deal with pets if you are having symptoms and other frequently asked questions. So if you go out on that website and look up things if you have some concerns, and obviously you might want to contact your veterinarian if your pet is having any symptoms similar to the humans. I don't see us putting surgical masks on pets, though.
Okay, very good. I have an elderly mother, 84 years old. Is it advisable to take her out of her senior independent living apartment to her 6-month April general practitioner appointment in the medical building adjacent to DCH?
It's a very good question. And my suggestion there would be that the individual who's going to bring their mom to the appointment contact the general practitioner to see if it's appropriate to do it for the mother's age and any underlying conditions. The medical building adjacent to DCH should be safe. It is kept clean and is, as reasonably safe as any other healthcare facility. But getting somebody out and about, depending on whether they have other risks, I know that a lot of practitioners are cutting back on routine exams, etc., during this period of time when an 84-year-old falls into those high-risk groups just because of their age.
Okay, thank you. Do you think the social distancing is working?
Well, it sure seems like it. It's too early to declare total victory, of course, and we're just starting to see everybody's talking about the curve flattening. But to me, if you look at the percent or the number of new cases daily, when those numbers start to go down, obviously we're doing a lot in our society with social distancing and with the other things, the hand washing, and now with masks. It seems to me that we might be seeing the fruits of our labor.
Great. If you have COVID-19, how long are you contagious?
Well, it's not an exact science, but typically, if you've had the virus for over a week, and then you have no symptoms for 3 days or longer, typically that is considered to be a period of time when you're no longer contagious. Now, having said that, you should always speak with your primary care physician or the clinic that has done the COVID-19 to discuss with them whether you should be tested to see if the virus has disappeared from your swab. In some instances, it would be important to get tested again, but that would be between you and your provider.
Great, thank you. Can you get COVID-19 more than once?
Viruses, typically, once you get this particular strain of the COVID-19, there's a 99. I've heard some of the CDC people that talk on TV and looking at the web page. It's very unlikely that you'll catch this virus again. There's always a possibility, but it's 99.9% unlikely. That's why it's going to become very important for us to be able to have available to us what's called the antibody test or the IgM test for COVID-19, which will tell us whether or not a person has come in contact and successfully fought off the virus and not had typical symptoms. That's going to be one of the keys to being able to get back to normal. And if you're watching TV or what have you, you'll find that the CDC is starting to talk about getting that test more available. It is not currently available, but it will be in large quantities fairly soon, a matter of months or weeks.
Great, thank you. Continuing with the questions about the spreads, safety, and risk levels, what is the lifespan of COVID-19 on surfaces? I think we talked about that. Or how long is an area affected after the contagious individual has left?
Again, we're talking several hours to days as best we can determine.
When boxes or crates arrive at our facility, what precautions should we take?
Typically boxes, even boxes coming from China, have taken a long time to get from from a distant site to where the box is. So unless you have reason to believe that there's some kind of contact with a contagious person, they should be reasonably safe, and there have not been, according to the CDC, any problems with contracting the virus from contacting packages, particularly if they've been in transit for a period of time.
Okay, I think this was part of that same question. The question was, let them sit for 24 hours, then open them and let them sit another 24, spray down with Lysol. Yeah, I think...
as an over precaution, I think some organizations might recommend that. If you're in a high-risk situation, such as you have an elderly person, you might want to consider that if you're concerned. But again, the CDC has stated that there have been no known cases that have been created from touching packages.
Okay. What type of environment can kill or deter the virus? Hot, cold, humid, freezing, dry?
Well, at this point, it looks like moderate heat might be effective against the virus. However, I would caution that we don't want to create a fire risk. So at this time, I would not recommend people, expose boxes and things like that to any kind of heat.
Okay. We went shopping yesterday and didn't know what to do with our groceries, so we basically sprayed everything down with Lysol and put some packages in a closet to sit for a few days.
Well, again, that should be effective. What you might want to do is check with the store where you're shopping, and they may be able to tell you what they have been doing as far as trying to prevent handling of various items by any of their personnel. So if an item has sat in a store for a period of 24 to 48 hours, it should be relatively safe.
Great. Any suggestions for lifestyle steps we take to stay healthy and boost our immune system against the virus? Supplements? Is vitamin C a good deterrent?
Vitamin C has not been shown to be specifically effective for this. There have been some studies about certain things such as zinc. I think it's a good idea to, if you think you have the virus, there have been some encouraging studies on the use of certain other agents to help the situation that you'd want to talk with your primary care doctor about, such as calcium channel blocking agents and aspirin. But of course, that would not be something that I would recommend without talking with your doctor.
Okay, thank you. Is this something we have to live with forever?
Yes and no. Viruses have been around for forever. We all know that. If you look at pandemics, this virus appears to be most like the pandemic of 1918. As a matter of fact, my grandfather was in the Canadian military and got the virus, the 1918 pandemic virus. He survived it, but he had a consistent temperature of over 104. So there will be periodic pandemics, and there always have been periodic pandemics. As far as this type of thing where we have to do the social distancing and close everything down, I think it is very unlikely that we're going to have to do this again in the foreseeable future. One of the things that's going to happen as a result of this is this will expand our attention and our resources on trying to be able to develop treatment programs and vaccines as effectively as possible. And so I think the likelihood that this is going to happen again is extremely low.
Okay, thank you. So now we move into questions about testing. How many test kits does DCHS have available to them? Do they have a reliable source of supply of tests? And are they ever planning to have enough to test more than just those that meet specific criteria? Known contact, travel, etc.
Yeah, that's a very good question, and I think is very important for us to understand. As far as test kits, the ability to do the testing, when the virus first started to break, that was a huge issue. No hospital had enough of the test kits. That is no longer an issue. If we need to test somebody at Dickinson, we have plenty of test kits to do it. Currently, there are still problems with the ability to do quick, rapid turnaround tests. Excuse me, but that is improving daily. The amount of testing that is going on has steadily increased on a national level, and the ability to test has improved. We started out with testing through the Michigan Department of Public Health laboratory and still do the lion's share of our testing through them. The turnaround time for the Michigan Department of Public Health test was over 7 days, which was very frustrating. Now the turnaround time once they receive the sample is sometimes less than 12 hours. So that is improving. The other thing that is happening is that the ability to test locally is starting to ramp up. For instance, our hospital does not have the analyzer that's available to do the test on site, but there are machines in the UP that have those. The issue that has come up with those, which is a test that you can get a result within a matter of hours, is that there's not enough what's called reagent. That is, every time you put a sample into the test tube and then put it into the testing machine, we don't have enough of the test tube material to run the test. And again, that is rapidly improving. As an example, last week we had no ability to do any tests in the UP, and Marquette's ability has now increased. There are also obviously, our hospital has ordered the analyzers, and particularly the instant or the very quick analyzer, the Abbott analyzer, and we will be getting that at some point. Finally, as I mentioned previously, there will be a testing available. It's called an ELISA test, looking for the immune reaction. This is a blood test as opposed to a nasal swab. And the advantage of that test will be to be able to tell if somebody's come in contact with COVID-19 and therefore would not be likely to ever get it again. So as part of this middle road when we're trying to get back to work, if we know that, for instance, a healthcare worker or somebody working in the factory has a positive ELISA test for having had the COVID-19, whether they knew it or not, could then safely go back to work and not worry about all the social distancing and quarantines and masks and hand washing that we've kind of come to know over the past couple of weeks. So testing is a very dynamic field. It is improving all the time, and I think I'm very confident that we'll have the ability to test much more rapidly and much broader within a relatively short period of time, probably measured in weeks.
So the next question is, do we have the quick test in the UP? Is that what you're referring to?
Yeah, the quick test is the Abbott machine. We currently have it on order, and for the reagent, like everything else, including toilet paper, once it's known that it's a needed substance, it very rapidly disappears. So we are on the waiting list to get one as soon as we can. But those types of machines will become more available as time goes on.
Very good. Does DCHS have any plans to do any antibody testing to evaluate who may have already had the virus?
Again, I answered that as far as this ELISA test that I mentioned. And the issue there is that the test has not, nobody has that test except for a small number of research labs and what have you. But that should become available in the near future.
Okay, and what symptoms warrant a COVID-19 test in a person who's not considered high risk? Is there any different if someone is high risk? Is this any different if someone is high risk?
Yeah, and that's a complex question in light of the fact that even though COVID testing is becoming much more available and more quick to obtain a result. So that is something that a person would absolutely, if you're having symptoms, you would need to talk with your healthcare provider or contact the COVID-19 clinic or the hotline and get advice from the healthcare providers there as to whether or not you would be somebody who would be tested.
The next question, how long does it take to receive results once someone is tested? I think you talked about the turnaround time with that.
Yes, yeah. Currently, we're looking at 1 to 2 days of with the state lab, who is currently our best resource. The issue that we're seeing with the state lab is that it's simply getting the samples out with the FedEx or the UPS and getting them to the laboratory in a forthright fashion. Once they're there, they're tested very quickly.
All right, the next question, I'm not really sure, but I'll read it anyway. What are all the symptoms? How would you feel?
Well, typically you feel like you got the flu, and we've touched on this many times. Again, the triad of high fever, dry cough, and muscle aches or myalgias are probably the symptoms that you get. From what I've heard, particularly if you're in a situation where you might be one of these patients that might have more serious problems with COVID-19, the symptoms are hard to miss. You're not feeling very well.
Okay. If someone is concerned they are infected or are showing symptoms, what should they do?
I think I answered that. I would contact your primary care doctor or the COVID-19 clinic or the hotline.
Okay, and who qualifies for a test?
Again, something that would be gone through the COVID-19 clinic or your primary care doctor. Currently in the state of Michigan, because of some of the limitations of the availability of the test, there are certain limits on who gets a test. So there's a form that physicians would need to fill out and then talk with a hotline at the state to get an authorization number that goes on it's called a PUI or person under investigation form. So and that process are things that are all taken care of again through the resources that we talked about.
So just to be clear on that, Dr. Carlson, that is a state-regulated program where unless they approve it, you cannot just walk in and be tested.
It's probably not a good idea to just walk in and get tested, primarily because it places a burden on the resource of the testing that's available. If you test through the Michigan Department of Public Health, which we have found to be the fastest and most reliable testing source for us, then you would have to go through that process with the PUI form. Private labs and private hospitals can do their own testing, but again, they're limiting their abilities. And what we found is that we have actually looked at how long it takes to get results back from the private labs and other hospitals, and quite frankly, the state lab is the quickest. So as a practical matter, you should go through that process.
Okay, the next question, what does the testing process look like? I think you touched on that, but if you could give maybe a little more information on the nasal swabbing and what that's like.
Well, it's not comfortable. I can tell you that from personal experience. The nasal swab that is currently being done does require that both nares have to be swabbed separately, and it has to be a deep swab. That is, it's not just a rim around the outside of the nose. So there's a bit of discomfort there. It's not bad, but you know you've been tested. There has been talk about a self-administered swab that eliminates the need for a healthcare worker to gown and glove and wear the mask and goggles and what have you. But as a practical matter, that would be the reliability of that test is still in question, and the availability of that test is in question. So it's It's something that you should do if you qualify for a test and should get a test, but it's not something that you'd want to volunteer for.
Very good. Thank you. So who is deemed at risk versus immunocompromised?
Yeah, well, if you are immunocompromised, you're also at risk. And basically, it's over the age of 75. Some of the other risks include chronic lung disease, COPD, heavy smokers, people with chronic heart conditions, people who are, and these are all older people, 65 or older, who have, for instance, diabetes. Immunocompromised patients are those who have, for instance, cancer, leukemia, or on medications that interfere with the body's immune mechanism, things like lupus, as we talked about earlier, rheumatoid arthritis, and some of the treatments that come from that. In Michigan, if you look at the daily reports of people who are hospitalized and, quite frankly, who have died from this COVID, there's a high male predilection for this. The numbers were 65% males, so I think elderly males are at a significantly higher risk, particularly in our state too.
Okay, thank you. So now we move into questions about medications and treatments. When you become infected, how long does it typically last?
Well, it's quite variable. As people are hearing, some people get it and they have no symptoms whatsoever. Some people have symptoms that they can manage at home with simple bed rest, taking some fluids, getting advice from your doctor about any other medications, etc. Generally speaking, I think we're looking at lasting for a week or so. Seriously ill patients on ventilators, though, one of the hallmarks of this disease, though, is that ventilator patients often will need to be on the ventilator for a fairly prolonged period of time, measured in weeks.
Very good, thank you. So if we have COVID-19, what type of over-the-counter medications are helping with the symptoms?
Well, the fever can often be controlled with simple Tylenol or aspirin. Plenty of fluids. Somebody talked about maybe vitamin supplementation. Zinc seems to come up fairly frequently in those conversations, and then plenty of fluids and rest.
Okay, so that leads to the next question. Since niacin burns fat, folks have been known to OD on niacin to burn THC out of the body. Would niacin burn through the outer structure of COVID-19?
It's an interesting question, but quite frankly, I'm a little bit concerned. Niacin can be obtained over the counter, but it does have some toxic effects. So I would not encourage people to take extra doses of niacin.
Thank you. Should the general public wear masks? If so, what type? I think we talked about that.
Yes. Cloth masks are probably going to become pretty ubiquitous, or a lot of people are going to be wearing masks, I think.
Any estimation of when the peak of this will affect this area?
Well, being an optimist, we might already be seeing some of the peak. It's difficult to say because the numbers in the UP are relatively low to start out with. If you're following one of the hotspot areas like Detroit or New York, to me, the key is to look at the number of new cases per day and compare that with the previous 4 or 5 days. If you see that number is leveling off or coming down, that means that we're going to see that area is seeing the peak lessen.
Very good. Do we have enough ventilators for the UP?
Another good question. We have been husbanding ventilators available at our hospital through our emergency supply, Region 8, and in keeping with Marquette General, which is probably our main referral source if we have a patient that needs to be transferred for care there. And at this point, it looks like we have adequate ventilators for the UP.
Very good. Does the hospital staff feel safe?
Well, I'll tell you what, I'm quite proud to be a member of the hospital staff. Nobody feels safe in dealing with this disorder, and nobody feels stronger, though, than medical staff about doing what they've been trained to do in times like this.
That's great. Current information on research for effective medication and medication availability if there are proven options identified.
I think this question goes back to this question of the Plaquenil and Z-Pak treatments. People should realize that there are studies that are currently being done to see how effective the Plaquenil and Z-Pak has become or will become. We're all hoping that it's as effective as some of the early studies indicated. However, having been around the block, we might eventually be disappointed. But from what we call it anecdotal, that is the results from some of the smaller studies and from experience of physicians who have been dealing with this disorder, it does appear to have some promise.
Great. So what's the update on outlook for vaccine availability in the future?
Well, obviously vaccine is going to be the answer to quelling this particular pandemic and any further echoing of the flu season next year. As a cautionary note, many people who are listening to this weren't around in 1976 when there have been a number of swine flu pandemics that have been through, and there was a swine flu concern for pandemic. And the caution that I mentioned is I was a medical student at the time, and the government at that point tried to rush through a vaccine. And that vaccine, unfortunately, was associated with a relatively high rate of unusual side effects. One of them was called Guillain-Barré, which is a form of paralysis. So the vaccine, the issue is you have to be cautious when you're talking about working with the immune system like a vaccine does, and be cautious that you don't rush something to the market or to the population before it's been proven to be number one, safe, and number two, effective. So having said that, it's very frustrating for us all that we're probably looking at a number of months, maybe even a year before we have a good vaccine. But virology being what it is right now, much better than it was back in 1976, we can hope that we get a good one sooner rather than later. But I think we're talking in a matter of more like a year or longer for the vaccine.
Great. All right, I think that brings us to the end of our presentation. Thank you, Dr. Carlson, so much for answering the questions and making yourself available to answer the questions. And for those of you who are listening or viewing, I will say that the main thing is if you've experienced symptoms or you're not feeling well, please contact your provider. And if you have additional questions, use the resources we provided. And again, our COVID-19 hotline is 906-776-5858. Feel free to use that as well. So thanks very much and best of luck to all. Goodbye.